So if you're just joining us, you can throw your organization and country into the chat so we can see where you're joining us from. I'm going to go ahead and get started. So my name is Susan Melnick, and I'm the Strategic Communications Manager here at ASAP 2, which is a Usaid project that stands for Accelerating Support to Advanced Local Partners. And our project supports local partners to become primes with Usaid, our path to prime, we like to call it. And we run this webinar series. I'm glad many of you, I recognize actually many of these names popping up in the chat. We ran them as part of ASAP 1, and we're continuing them into ASAP 2. So we're really excited to be able to do that for you. And of course, we're able to do that because of the support of PEPFAR and Usaid. So today's webinar is PEPFAR Expenditure Reporting. This is a repeat webinar of one we did last year because there have been some updates and changes to the process. And so Usaid is here to assist you in getting that reporting done this year. A couple of quick little reminders about how our webinars run. So again, if you're just joining us, go ahead and throw your organization and country into the chat so we can see where you're from. We use the Q&A box as part of all of our webinars. So at the bottom of your screen, you'll see a little Q&A box. It may be in the portion that says more or through 3 dots at the bottom. And you can go ahead and pop that up. And if you have questions throughout the webinar, please feel free to add them there. We're going to be using the chat mainly just to communicate and say hello to each other, but we'd really like to use the Q&A for any of your questions that you have. It allows us to really keep track as we have quite a number of people who have joined us today. We have 3 polls during the day, so they're going to pop up on your screen and you'll be able to answer them. And once you're done and you hit submit, the box will go away. So no need to do anything extra there. One of the polls is actually going to be in the chat. So Erin will let you know at that point and you'll be able to go ahead and answer in the chat. Today's presentation will be recorded and we add it to the ASAP Resources website. So I'll go ahead and send that link out following the webinar as well. And you can go and see all of the past webinars, and this webinar will be on the website by tomorrow morning, Central Africa time. So this is actually going to be our 77th webinar under the entire ASAP project and the first webinar under ASAP 2. So we're really excited to get these kicked off. Again, you can visit the ASAP website and access all of the past webinars, and the presentations are also on there to assist you. You'll be able to choose your language for many of the webinars. We run many of them in French and Portuguese as well, and I'll tell you a little bit more about that in a moment. But through the website, you're able to filter and choose the language that you'd like, as well as the topic, of course. We'll have the presentation available as well on the website, so you can look it over a little more closely in case you miss anything today. And of course, the recording will be there. And now it is my great honor to introduce 2 of our presenters. So Erin Dunlap is the Technical Advisor for the SIEI Division for USAID's Office of HIV/AIDS. And Sushant Mukherjee is Director of Financial and Economic Analysis for the Elizabeth Glaser Pediatric AIDS Foundation. So we're really glad to have them both here. I just wanted to let you know that this specific webinar is going, oh, I just lost my thing. Hold on 1 second. You have to have at least one little technical glitch, and so that is all on me. Hold on one moment. There we go. Okay. All right, well, I seem to be having a little technical issue, so I'll just quickly show you. We are going to have a number of additional ER webinars. So this webinar will be held again in 2 different languages. On September 13th, we'll be holding it in French, and on September 15th, we'll hold it in Portuguese. So I'll be providing that information in the chat in just a little bit, so you could register for those as well if you feel more comfortable listening in those languages, or if you'd like to share them with coworkers who would prefer to hear them in those languages. And then on September 8th, we have another very important reporting webinar about local partner training on the new PEPFAR Human Resources for Health reporting requirement. So that's just in a day or so. We have it on Thursday, and I'll be sure to share that registration as well. So you can go ahead and get signed up for that if you are not already. So these are two very important parts of the October reporting schedule. All right, so I'm going to go ahead and pass it over now to Erin. Let me stop sharing.
Hello, everyone. Thank you for joining. Susan, can I ask that you please launch the first poll, please?
Absolutely.
And we're just going to kick things off today with just a quick poll to get an understanding of everyone's comfort level or experience with expenditure reporting in the past. So you should have had a pop-up on your screen right now. And the first poll question is, how many times have you reported your PEPFAR expenditures for the annual expenditure reporting requirement? So if you can just click that, your answer to that poll, that would be really helpful just for us to get an idea of, since we have quite a lot of folks joining, what the comfort level and experience level with expenditure reporting is. So we'll kick things off there for just 1 second while I pull my slides up. All right, and please tell me if you cannot see my slides. But thank you again, everyone, for joining today. I know this is a very busy time of year for all of you, and it's great to see such representation on the call from our local partners around the world, and even from some locations outside of Africa. And I saw some Usaid activity managers and CORs on the call as well. So that's great to see that we have a good representation here. And it also looks like, as a result of the poll, 48% of you have said that this is your first time reporting to ER this year, which is great. This is why we have this webinar, is for the 48% of you that have never done this before. 17 of you have reported once, and then 35% of you have reported twice or more. So we kind of have sort of two fields of folks. And before we get too much further into this, I just wanted to get one more, see if I can poll you one more time and have you answer one of these two questions in the chat box. So if this is your first time reporting in ER, what is your greatest concern for doing this for the first time? And then if you have reported to ER in the past, what did you find was your biggest challenge with reporting? So if we could take maybe just, 10, 15, 30 seconds for, there's no wrong answer here. It's just for my benefit so that, I can better understand your perspective as a partner that is reporting for the first time, who has never reported before, or maybe you've only reported once and you thought, gosh, that was a little tough. I'm not sure how that went. So just knowing from your perspective, it's really important for me to just know, is it intimidating? Is it confusing? What are some of the things that are really a struggle? So I thank you for those of you that have started to put some of your answers in the chat. Again, no wrong answers here. Appreciate that. This is helpful. Yeah, and please keep putting these answers into the chat. This is great for me to know. So yeah, exactly. So I mean, there's just a lot of different common questions and challenges that are shared amongst all of you on this call today. No one is alone in how you're feeling if it's a little overwhelming, especially since expenditure reporting is just one of many, many reporting requirements that I know all of you have going into the end of the fiscal year. And so these are very common questions and concerns that we've had from our partners. So just know that you're not alone. And that's part of what I hope to share some information to make you feel a little less concerned about expenditure reporting. We're going to get through this. It's going to be okay. We've got plenty of time to sort out any questions or concerns as time goes on. Okay, so just a quick overview of the agenda for today. So we have 2 hours together. So we'll quickly go over the PEPFAR financial framework. And for those of you that are unfamiliar, this will be a very quick overview, but an overview nonetheless. We'll go through the requirements for what's new for fiscal year 22 ER reporting. We'll go through some of the resources that are available to assist our partners to complete the expenditure reporting requirement. I have just a couple of slides on what the US government does with the data that you submit to us. And then I will pass this on in the second hour to my colleague, Sushant Mukherjee, who is an implementing partner with EGPAF. And we have found that it's really impactful to have prime partners who have a tremendous experience, as Sushant does in his organization, to help some of you from the partner perspective on what has helped getting started with ER. And just as a quick note too, there is a Q&A at the end, but I will be taking questions throughout my hour. And so we'll definitely pause a couple of times throughout to take questions. And so you don't have to wait until the end. So please do not hesitate as we're going along to drop your questions in that Q&A box, and we'll get to them after I finished each section. Okay, so first off, what is the PEPFAR financial framework? And so a lot of our partners that are reporting for the first time will often wonder, why must we report on budget and expenditure data? And one distinction that I want to make here is for those of you that are working more on the finance and accounting side, you know that there might be, other financial reports that you submit to Usaid, the SF-425 or SF-424 or something like that. And that is sort of your contractual and these legal documents that you're essentially certifying your expenditure to the US government at a very high level. It's sort of on a contractual legal level, that's your financial report. However, we also, as I think many of you know by now, PEPFAR is an incredibly data-driven initiative. And so when we're only looking at our indicator data and some of our other qualitative data and not the financial data, we're really missing part of the picture. So this is going beyond just sort of that contractual financial report, but we're actually now talking about data. And that's what we're asking for our partners, is to tell us on a programmatic perspective, how are we actually investing in our funds? And are we, kind of working in the right places and spending our money on the right things as PEPFAR as a whole? So for those of you, again, that are really unfamiliar with the financial framework, it really just works on an annual cycle. That cycle starts on the left with number 1, which is the US government sitting down to set strategies and budgets and targets for a given country, or we use the term OU or operating unit oftentimes. We really just mean country. So basically historically from January until about May, the US government is internally discussing, what are we going to do in Botswana for the next fiscal year? What are we going to do in Burundi for the next fiscal year? What are some of our key priorities and strategies that will get us closer to our 95 goals in each of these countries, considering, of course, the epidemic is different in every single country. So we really spend about 5 months as a US government discussing what those strategies need to be, those activities, those key populations, and then, of course, the targets and budgets are set at that time as well. After the COP has been approved, we move into the work planning process. And I think most of you at this point have probably been engaged in the work planning process, at the very least for COP22, which is what we just finished. And so that's when you, as the implementing partner, in advance of the start of that implementation year, you now find out from Usaid, what are my budgets? What are my targets? What am I going to do for the next fiscal year? And then you will write up a program narrative. You will also write up a program kind of budget notes in your budget narrative, and then you will submit a work plan budget template to Usaid through the DATM system, indicating to us how you will actually implement the budget that was set by Usaid for you. So that's all in advance of the fiscal year, the implementation year. And at the end of the year, we have expenditure reporting. And that's what we're about to go into right now, where we look historically at what was spent in comparison to budgets. And I do just want to make a clarification that we, as a US government, we are setting budgets to the best of our abilities, but budgets are an estimate and they should be a very best estimate. But it's possible a lot of times that budgets are set and then during the implementation year, something happens. And so your expenditures will not match your budget. Now, of course, hopefully you will have discussed with Usaid throughout the year what was going on. You know, maybe there were implementation delays due to some sort of security or political circumstance. Maybe things just ended up being more expensive than how we planned them a year ago. Maybe there was a pandemic. So there's a lot of different reasons why expenditures don't always reflect the budget as it was planned. But it's very important to Usaid that we look at your expenditures as they were actually incurred. We don't just want you to send us the budget and say, well, this is the budget you gave us. Sure, that's how we expended it. Tell us what actually happened so that if we can see that there were delays or there was over underspending with your data, then we can better understand how to plan better for the future. Okay, so going into the classification. So basically with financial data, we have three main lenses in which we look at our PEPFAR investments. The first lens in which we look at our PEPFAR data is what we call program area. And that is pretty self-explanatory, right? I mean, it's essentially what activities how are we funding activities related to testing or to treatment or to prevention, for example. These are 6 high-level categories, but we also disaggregate these even further. So for testing, for example, we can disaggregate even further to see what are we spending on community-based testing versus facility-based testing for a given partner or within a given country or something like that. So the first lens in which we look at PEPFAR financial data is that program area. Now, the second lens in which we look at PEPFAR financial data is the beneficiary. So who is benefiting from these investments? Who are we targeting essentially? And so you can see that there's 7 major groups that are listed here. And they're pretty self-explanatory. The first one you will see says non-targeted population. And what that really means is a lot of our programming is targeting either a general population, so it's some sort of combination of the other 6 beneficiary groups. So maybe you're targeting, females and males specifically, or maybe you're targeting, pregnant and breastfeeding women and key populations or something like that. So sometimes we can select the non-targeted population group if there's really just no way for us to determine what the breakdown is for a given beneficiary. That being said, a lot of these population groups are very, very critical to PEPFAR programming. So we might want to disaggregate as best as we can to just better understand our investments in pediatrics or in pregnant and breastfeeding women, or in some of our key populations, for example. It's important that we can disaggregate these beneficiary groups when we can, but oftentimes when it's difficult or we're targeting more than one, that non-targeted population is fine too. Okay, so we've talked about the 2 classifications, the program area and the beneficiary, and you can see those listed there in the rows. And then I had mentioned that there were a sub-program area and sub-beneficiary groups, right? So that additional level of detail. So what we do is when we put the 2 together, what we're really creating is an intervention. So when we go across the expenditure template, what we're essentially defining is what is our investments in our community-based testing work for sex workers? Or how much did this particular partner spend on education assistance on the service delivery side for OBCs? How much did this partner spend on HIV clinical services that's non-service delivery for adult males? So you can see as we go across the different interventions, we're really just wanting to understand investments for those targeted, that a combination of that program area and the beneficiary. Now, that third lens that I haven't yet mentioned in which we look at our PEPFAR financial data is what we call a cost category. And that's very simply, what are we buying? What is the implementing partner buying? How much do we spend on salaries, which is a huge driver of PEPFAR investments, right? How much does a particular partner spend on travel? How much does a partner spend on training? So These three main lenses really help us at Usaid to better understand our investments and to also have a discussion on where there might need to be shifts on these investments if we're not working effectively or efficiently. Okay, so now that we've looked at the classifications, let's take a quick look at the expenditure reporting template that you will complete as part of your Q4 reporting requirement. So as you can see, each of the rows, it's just like that previous slide we looked at. We've got the program area on row number 1, number 2 is the beneficiary, and number 3 is that cost category. So what you as the implementing partner will do is essentially go across each of these columns and make those definitions. So again, for that implementing partner, a sample implementing partner that we have here, this partner is reporting on their facility-based testing expenditures for service delivery, targeting adult men. And then within that specific intervention, we're seeing that they invested $234,000 on healthcare worker salaries, $95,000 on fringe benefits, $342,000 on the pharmaceutical. So that gives us at Usaid a better understanding of what we're spending by program area, beneficiary, and cost category. And then just a quick note then on level of detail. So for some of you, and you're thinking maybe about all of the different activities that you do, and if you were to actually list out all of your program area, all the different combinations of interventions, you might think, gosh, we could have 100. Is that really what we're going to have to do for this exercise, is list out every single population, every single service delivery, non-service delivery program area? No, we cannot ask that. It's too much of a level of information and too much level of detail to ask our implementing partners, especially when we know that your accounting systems are not structured to track your expenditures by that program area, the beneficiary. I mean, they're just not set up that way. And so essentially the expenditure reporting template is limited to 35 interventions only. So what that means is there's going to be times when you might want to combine some of your expenditures, or what we call lumps, some of those expenditures together into one intervention. If you sort of know that lumping them together isn't going to really affect the data that much. But then there's other times where you might be doing activities that are really critical to what your project does, or you're working with certain beneficiary groups that we want to be sure we're tracking and monitoring that, where you want to be sure that you are splitting that information out so that we can see that level of detail. Because ultimately what you're doing when you're submitting an expenditure template is you are telling a story about what you are doing. And so if I'm brand new, I've never worked with your organization before, I don't know anything. If I'm looking at your ER template and there's 3 columns filled out, one's for testing, one's for prevention, one's for clinical services, and it's all sort of a non-disaggregated way, then I'll say, okay, well, this is what this partner does. You know, it's a little bit of testing, a little bit of treatment, and a little bit of prevention. But if you were to tell me, oh, but actually we do a lot of work with pediatrics, or we do a lot of key populations work, if I don't see that in your template, then there's no way for me to know that that's what you're doing. So there's not a right or wrong answer here necessarily, but we do want to strike a little bit of a balance of enough information so that we know what you are doing, what you are implementing, but not too much information where it becomes really difficult to report. So I have 2 examples down here at the bottom to help describe this. And so the first example is we have an implementing partner who does a mix of clinical service delivery and non-service delivery. So it's about 80% split to service delivery and 20% non-service delivery. Should that partner lump or split their expenditures? And the answer here is, let's just assume that this type of work is just general care and treatment work. I think it's okay, since the majority, the 80% is service delivery, go ahead and lump 100% of that into service delivery, because it's really not going to change the way that we look at your data that much. Another way to kind of help better understand this is, especially when, let's say this mechanism may have $1 million in expenditures. If an intervention has $2,000 in it over a mechanism that has spent about $1 million, $2,000 is really kind of a drop in the bucket. It's not really going to move the needle too much. It's, and you can tell us qualitatively, oh, we do a little bit of non-service delivery as well. And that's okay. Again, this is a best estimate at the end of the day. But now that being said, our second example, we have a partner who pays for clinical activities that primarily benefit the general population, but on average for the year, about 30% of the clients are pregnant and breastfeeding women, who are an important population for that program's implementation. Should we lump or split the expenditures here? And in this case, I would suggest actually making sure you do split out the allocation of those expenditures 70% to a non-targeted group, and then still call out the 30% to pregnant and breastfeeding women. Because again, if you don't have it in your template, we'll never know that you as an organization are working with pregnant and breastfeeding women. So it's a little confusing to sort of know what the right and wrong answer is here necessarily, but just think about your expenditure template as telling a story. What do you want to tell me about what it is that you do as an organization? Okay, so I will stop there and take a few minutes and see if there's any questions on the classifications. We still have other sections that we'll talk about reporting and the template and things like that moving forward, but anything on this last section that I've talked about?
Yes, so we do have a question specific to the categories. The question is, it's saying that you can combine expenditure categories. I don't understand how this is done, as when we input our budget, it does not align with the ROP budget and it's rejected. If we submit our expenditures and it doesn't align with the annual budget categories submitted and ROP budget categories, how can lumping be done?
So this is a great question. And so when you are looking at your ROP budget, which is the regional operational plan for countries that are in a regional office or in a regional OU, so this is a good question. So you do receive your budgets from Usaid, and it is according to that program area and beneficiary. Again, these are estimates, and oftentimes those estimates may not be as disaggregated as maybe you, the implementing partner, think needs to be done. That's a conversation that I would recommend having with your ACOR. Again, if you are given a budget by Usaid and it's maybe these 3 interventions and you say, oh, by the way, but we think we could actually disaggregate this group one further and say that let's split this into 2 beneficiary groups so that you can see the work that we're doing with this additional beneficiary group. 9 times out of 10, I mean, Usaid will agree with that suggestion in my experience. It's always better to sort of disaggregate if you as the partner think that that's possible. And if for those that are from Usaid that might be on the call, I mean, just consider too that, I mean, I think that while Usaid is setting these budgets, if partners are making suggestions on how to further disaggregate, not changing any of the budget, not changing any of the top lines, but if they're just saying, we can provide you with more detail, it's actually not that difficult for us to do, I think that's a very acceptable suggestion. But I would say to the implementing partners, it's a conversation to have with your ACOR and just understand that, the top lines aren't going to change or anything like that. But if you think that you can disaggregate further and tell your story a little bit better, I don't think that's a reason to reject the template. But at the end of the day, it's your COR that will make that decision.
Excellent, thank you. We had a question about what you mean by non-targeted population.
Yeah, great question. So let me just go back a couple here. So that number 1, where it says non-targeted population, again, this is when essentially you as a partner are working with either more than one of the other 6 beneficiary groups, or you're really just working in a space where you're targeting the general population. So if you're paying salaries for volunteers at a clinic or in a community setting or something like that, and there's really no way for you to say, well, it's 30% males and 20% females or something like that. In some cases, you may just put non-targeted, non-disaggregated, because it's impossible for you to know who comes into clinic even on a monthly basis, let alone an annual basis. And I think that's fine. If you're not targeting anyone specifically, it's fine, I think, to do that. It's really in those cases where if you are an OVC, an Orphans and Vulnerable Children mechanism, or a key populations mechanism, or if adolescent girls and young women is a really important critical population in which you're serving, then you'd want to disaggregate by that beneficiary group. But if it's really just a combination, or it's the general population, then you can select that non-targeted population as well.
Excellent, thank you. We have a question about the DUNS number, how to report specific ERs to sub-partners who do not have a formal partners number, so no DUNS in Datum.
Okay, hold on to that question. We will get to it in the next section here on the DUNS and the UEIs. And I'll take maybe one more question if I can, Susan, before I scoot along here to our next section.
Sure, hold on one second. So how would you report expenditure components whose funds are combined with other USAID and COVID funds?
Another great question that we will discuss in the next section. So why don't we just move right along to that, since we're getting some of these questions. So this is essentially the requirements for expenditure reporting, as well as what is new for this year, which are the last two questions that we just got. So if you are reporting for the first time to ER, essentially this is the methodology for how you will determine what you include in your ER template. You will want to include all expenditures for the fiscal year that just ended, which is it's ending. It hasn't ended yet. We still have a couple more weeks. But for the fiscal year that is, when you submit your report, it will be in the new fiscal year. So it will basically be for fiscal year 22. And so the timeline there of the eligible expenditures is October 1st, 2021 until September 30, 2022. You are going to report your expenditures on a cash basis of accounting. And I understand that many of you probably do not operate on a cash basis of accounting, but this is the way that ER was really set up. It's just easier for partners to be able to look at on a cash basis, only report on the expenditures that essentially, you paid out and that have sort of left your bank account as of September 30. So even though you may have accrued a lot of expenditures on September 30, you will only include the expenditures on your template that were actually paid out by September 30. And so we understand that there's going to be some timing differences there, right? So if you accrued some expenses for this year, but they don't get paid out until October, you will report them on the next year's expenditure report. And we know that that's an allocation basically to this current fiscal year, but it's just easier for us to have this kind of guidance that you will report on a cash basis of accounting. It's important that you report your expenditures in US dollars and not local currency, as you do with your other USAID financial reports. To the question that we just had, you will only include PEPFAR funding. So do not include USAID malaria money if you get that, for example, or if you receive USAID family planning money or any other kind of USAID money, you will not include that. Or if you receive another type of HIV money, like from the Gates Foundation, do not report that HIV money, only USAID PEPFAR HIV money. And you will include COVID funds, but you do not need to disaggregate those COVID funds as COVID. They will just be it should have been planned by program area and beneficiary, those COVID funds that you might have expended in fiscal year 22. So just go ahead and include those, but there will be nowhere in the template where you will need to indicate that these are COVID funds. But you do want to report PEPFAR COVID funds. Let me just clarify one more time too. So any funds that were PEPFAR funds that might have to do with the overlap with PEPFAR. If you have any other funds that are related to just COVID and they're not PEPFAR funds, do not report those. Again, only PEPFAR funding. Okay, and then the prime partner, as has always been done in previous years, the prime partner is responsible for uploading and submitting all eligible ER templates into Datum. So your sub-partners will be reporting templates for the first time this year, some of them. They will not need to report in Datum. We only have USAID, we only have a contractual relationship with the prime partner. So we cannot ask your sub-partners for information. There is a contractual flow. So the subpartner reports to the prime and the prime reports to Usaid. So nothing really changes as far as who submits an ER template to Usaid. It will still be the prime partner collecting the sub information and then reporting it to us. So a couple of things that are new this year. So the first is just some minor administrative updates. The first being the financial classification reference guide, which is our complete guide of definitions. Please be sure that you go download that from Datum Zendesk before you get started. We did get the question on the transition from DUNS numbers to the unique entity identifier. So for any of you who have reported to expenditure reporting in the past, you needed to include what was called a DUNS number, which essentially identifies you as a US government vendor. And you needed to include that in your ER template. So the organization, I'm not sure which it is, the US government agency that sort of manages all of this has transitioned the DUNS number into what is called now a unique entity identifier, or a UEI. So if you have already registered and you already have a DUNS number, you already have a UEI. It is just that if you do not know what that UEI is that has replaced your DUNS number, you should go into sam.gov, basically anytime, and ensure that before you start your expenditure reporting that you know what your UEI is, as well as what your sub-partners' UEIs are, because they will have to report that in their templates as well. Again, you cannot be a US government vendor without a UEI. So this is just one of those kind of requirements that has to be on your template and that identifies your organization. I think the question was, what do you do if you do not have a UEI? So please go to sam.gov and attempt to register that UEI. If you have attempted to register and you, for some reason, were denied or somehow were determined to not be eligible for a UEI, I would say go ahead and reach out to oha.ea@usa.gov. And this email address is later in the presentation, and we will help sort this out for you. But what we've essentially been assured is that every organization should be eligible to have a UEI. If you tried to register in the past and were, for some reason, said if you're an international organization, you don't qualify, try again, because I think that this has been an issue that was resolved, is what I was told. Okay, and so I mentioned earlier that essentially the biggest change that we have here is subrecipient data collection. And so subrecipients have always had to submit expenditures to the prime. It's just that it was in an aggregated way. It was sort of a subrecipient spend by intervention, but we didn't ask subrecipients to say, how much do you spend on salaries or on trainings or travel or something like that. This year, it will be a change. If you are a subrecipient and you have expenditures that are greater than $25,000 in fiscal year 22, you will need to complete an ER template. If you are a prime partner on this webinar and you know that you have subrecipients that have spent more than $25,000, you will need to coordinate with your subrecipients to ensure that they comply with completing an ER template, because you will then be responsible as the prime partner to collecting and uploading and submitting those templates. So just a quick rundown. So if you are, it's very clear, if you have spent more than $25,000, you must complete a template. If you're a subrecipient that has spent less than $25,000, what do you do? It essentially will be as it has been done in the years past. If you have subrecipients that have spent less than $25,000, they will essentially just still need to report that lump sum amount to the prime partner, and the prime partner will include that in the template. So just be aware that the template does have data quality checks in it. So if, let's say, for example, you try to not have your subrecipients complete a template, and so you're reporting that you have 5 subrecipients that spent, $100,000, the template's going to reject that and say, no, this is more than $25,000. These subrecipients need to complete their own template. let's say you're a prime partner and you have 5 sub partners, and you have 4 sub partners that have spent more than 25,000. It's very clear they will complete an ER template. But let's say you have also 1 sub partner that has spent less than 25,000. You can have that mix. So then that sub partner will go on the primes template, in which case you'll have 1 prime template that has the primes expenditures, and then that 1 subrecipient reporting for $10,000. And then you'll have 4 separate subrecipient templates that are all greater than 25,000 individually. So again, I already kind of mentioned that prime partners will be the only ones that will need to submit the templates and datum. I don't want to spend too much time on this just because there are tremendous materials that are coming out that will be posted to Datum Zendesk to help you understand different scenarios and how all this will be reported. So if this seems a little confusing, or we're not really looking at a template right now, it's not very concrete, but don't worry, I think it will become simpler. There'll basically be 1 template posted on Datum Zendesk. It is not posted yet. I believe it will be posted tomorrow. I'm not entirely sure on that, but it should be any day now. The template will be posted. But you will basically need to indicate whether you're a prime partner or a sub partner in the metadata tab. As I've outlined here, you'll say I'm a subrecipient or I'm a prime partner. And then essentially this is what the template will look like. From the prime perspective, again, it will look just like years past. You will indicate your expenditures as the prime at the top. Down at the bottom, any subrecipients that have spent less than 25,000, you'll list them out there and their total lump sum amount by intervention. And then for the subrecipient template on the right, it essentially looks just like the prime template, right? You'll need to then disaggregate what your expenditures are by intervention. So, again, this table gives you a breakdown of what do you do if I'm a prime, if I'm a sub, if I've spent more or less than 25,000, and then what my action is. Again, there will be tremendous detailed materials and guidance that will be posted to Datum Zendesk, hopefully this week, that you can review. We will send out through our channels as soon as it gets posted so that you can review as well. I would say it's kind of it's a change from previous years, but also fairly straightforward as well. These are the timelines that we're working on. They're pretty much the same timelines as in years past. The 2 most important deadlines that I'd say you have to work on are the first being November 14th. So that is the first complete due date of when the expenditure reporting templates are due for the prime and all of the eligible subrecipient templates. And please note that November 14th deadline is a hard deadline. So you must successfully upload and submit your template by that date. I think it's something like 5 p.m. Washington, D.C. time. We cannot accept templates by email. We cannot accept templates that are late. So please mark this down as November 14th is a hard deadline. I would actually, the last week of reporting gets pretty wild. So if I were you as an implementing partner, I would aim to actually submit the week before, so that if you encounter any technical glitches or any issues or something like that, you still have a few days to respond to sort of rectify that. And then between November 14th and December 1st, that is essentially when the data is packaged and a structured data set is created, and then Usaid will visualize your partner data, and then we will do final data quality checks. And it's possible that you might be requested from your AOR or COR to make slight revisions. I've seen in the past, one partner forgot to report like $1 million. And so they went back and they amended their template in that December timeframe, for example. So it's possible that even after you submit November 14th, you will be requested to make a revision, and you'll discuss it with your COR. But then that final deadline when fiscal year 22 data is locked for the year is December 16th. And I know that that's around when folks start to go on leave for the holidays and things like that. But understand that this is your one shot to report expenditures for the year. And we will use that data moving forward to discuss during COP planning and to discuss in quarterly reviews we cannot revise that data after December 16th. It is locked. So please just keep these deadlines on your radar and try not to let things go too late, because once we have this data for fiscal year 22, it cannot change. And that's all we have to go with. And you would be surprised actually the number of, when we sit down during COP planning in January and we look at this and we realize, oh, the partner reported this incorrectly, or we forgot expenditures. It's sort of too late. I mean, and then it just kind of makes it more difficult for us as we're discussing data in the interagency to be able to say, oh, well, they only reported $1 million, but actually they spent $2 million. And it's kind of like, well, we don't see that. So it just makes the conversations a little bit harder. So just bookmark these dates and ensure that number one, you submit and you get that done on time, because the worst case scenario is we don't have anything for you at all. But then number two, just really, this year especially, I think is a really important year that we get it right as much as we can. And then just a couple more nuts and bolts, and then we'll take another quick break for Q&A. So what do you need before you report? You essentially need, number one, a copy of your fiscal year 22 budget by intervention. This is something that your COR will give you. So my team is generating these kind of budget reference files now, and I think we will disseminate them next week. So if you did not receive your budget by intervention for fiscal year 22 from your COR, you should receive a copy of that from them in advance of reporting. And again, this is just a reference. So just because it may say this is what your budget was, if something happened during implementation that is different, please report what actually happened. But we will be sending you those reference files probably in the next week or two. The second thing that you'll need to do is download the template. Again, the template is not yet live. I'm told that it should be live tomorrow at the latest, but just remember to check back. It needs to be the COP21 fiscal year 22 ER template. If you download the template that's there now, that is the old template, unless they made a change since this morning. But if you download the COP20 fiscal year 21 ER template, you will have done all this work only to have it rejected in the system. Make sure that it says COP21 fiscal year 22 ER template. And then last, the thing that I would recommend that you download is the classification reference guide, which again is really all of the definitions that if you have questions on how do I categorize rent, how do I categorize certain beneficiary groups, all of these definitions are there. If you are a prime partner on this webinar, you will need to log into Datum and upload all of the eligible templates. You as the prime partner in your template, as well as all of the subrecipient templates into Datum. You will need to do a two-step process of not only uploading, but also submitting. Then Usaid will go in and review and approve. So last thing I will say, if you are a prime partner on this webinar, I suggest you have at least one person, but you probably could have more than one person register your ER budget Datum account. Do it now while you have time. It takes 2 seconds. So that when you are ready to submit your template, that you already have your account sorted. Another thing that I've seen organizations do is they will create an organizational Datum account, which is completely fine. So you have an, just a generic email or a generic Datum account with a password that you share with a few people, so that if so-and-so who was supposed to submit the template is sick that day, or maybe they moved to another organization, there's other folks that have access to the username and the password and they can go and submit. So either way, however you want to do it, but don't just put all your eggs in one person's basket. I'd suggest at least 2 people have accounts, or consider having an organizational account. If the Datum accounts sort of deactivate after 95 days of no usage, basically. So if you are someone who thinks that you are going to have to submit the ER template this year, and you have also logged into Datum in the past 95 days, say to submit a COP22 fiscal year 23 work plan budget template, then you should have an active account now. Maybe go back in and just log in and log out just to keep it active if you're not going to submit anything until November of this year, is just a suggestion. But if you haven't logged in within the last 95 days, you'll need to essentially either request a new account or request for it to be reactivated on datum.org. Okay, so let me take another quick, let's say like another 5-minute break here.
Sounds good.
For
so we
questions.
have a number of questions. So just as a reminder to everyone, we did have the question about if people can invite their subrecipients to the French and Portuguese webinars, and of course you can. So I've shared that link in the chat. So feel free if you need to provide more information. One of the more practical questions that we got is about converting local currency into USD. So for this type of reporting, what's the best way to find that exchange rate?
Great. So I would reach out to your AOR or your COR because every organization has different methodology that is used on how to calculate what that currency conversion should be. But you as an organization should have some type of methodology or process on how you essentially will convert that currency for other financial reports. So I hesitate to give any guidance because I know that every organization has it sort of differently. But if you reach out to, or your contracting officer as well can also, I believe, give you that information. But the Usaid has guidance on this, but I don't want to give any guidance that might be different from a contracting officer or a COR, their representative as well. But I just ask them what methodology they prefer for converting that currency, and and do your best. I mean, we understand that there's going to be variance related to that, and especially in some countries. I mean, there's quite a lot of variance on a daily basis. So we understand that it's not necessarily going to be exact, but I think as long as you have a methodology that makes sense to your organization for not only for ER, but your other contractual financial reports, that should be just fine.
Okay, great. We had quite a number of questions around the 25,000 cap for subrecipients. So one of the questions was, is that an annual expenditure?
Great question. That is an annual expenditure. So that is for the entire fiscal year of that is for the entire fiscal year 22. You have spent less than or equal to $25,000 or greater than $25,000 in fiscal year 22 in US dollars.
Excellent. And another question related to that, are subs who are greater than 25,000 included in the prime ER in addition to their own ER or just on their own?
Okay, so if I follow that question correctly, so if you are a subrecipient, so there will always be a prime partner, right? There will always be a prime that has their own expenditures. And it just depends on how many subrecipients there may be. Some of you may have no subrecipients, which makes this very easy for you because nothing essentially changes. But if you have any subrecipient partners that spend over 25, they need their own template. It's one template per subrecipient spending over $25,000. So again, I gave that example. If you're a prime partner, that's one template. If you have 5 subrecipients, 4 of whom spend more than 25,000, that's 4 more templates. Okay, and if you have that 5th subrecipient that just spent 10,000, then if you will see this example on the left down here at the bottom, this is where you will enter. I don't know if you can see my arrow or not, but down at the bottom, you can see that line in the red box that says number of subrecipients, and then you list out your subrecipients. But you can see, I mean, this is only looking at 3 or 4 interventions here, 3 interventions, but basically the total spend for this subrecipient is less than 25. So that is why it is okay for that subrecipient. And actually this is by row, so not even by total. This is 1 row per subrecipient. So this subrecipient here only spent $1,000. They don't need a template because they didn't spend 25. They only spent 1,000. So that's why they're okay to be included on the prime template. And same thing when you look at all these others. These essentially need to total in the row by less than 25,000 for them to be on this template. If any of these rows sum total to more than 25,000, then you need to ask that subpartner to download the ER template. They'll need to select subrecipient here in the metadata tab, And then they will report their expenditures that, as you can see here, are in total greater than 25,000. And again, I know we're not really we're not going through the template, and it's not very practical, so it's a little confusing, but there will be, the guidance material has a number of different scenarios that make this quite clear. And as well as the template will not allow you to submit anything incorrectly. So I think it will be pretty straightforward. It's just, it's difficult when we're not spending the time to go through the template per se, but I don't have the template, so I can't do that for you. It's not been posted yet. And then maybe Susan, let me just do maybe like one more question, and then I'll quickly wrap up the next two sections sort of together, and then I'll hand it over to Sushant.
Sounds good. There was one additional question about the 25K threshold. Is it only for subs on co-op agreements or also for FAA?
Okay, so this is a great question that I would like to give some clarifying guidance for. So for the FAAs, for the fixed amount awards, I know in previous webinars we've had this question, and we've given guidance that, I mean, if you look at your contractual guidance, if you are a partner that is working on an FAA, expenditure reporting is required. It is required in all PEPFAR agreements. We do recognize that this is somewhat in conflict with the nature of a fixed amount award, where you are essentially being reimbursed, or you're being paid rather, for a deliverable, regardless of what the cost is to you as the partner. And you are not submitting detailed financial reports to Usaid. You're just being paid for that deliverable. So our guidance, after discussing this with OAA at Usaid, so our guidance on fixed amount awards is that, and listen carefully here. So our guidance is that because of the nature of fixed amount awards, it is not required to submit an expenditure reporting template. However, it is strongly, strongly recommended. And I say that because if you think from your partner's perspective, if you are a fixed amount award and you do not submit an expenditure reporting template, we do not have data for you. And again, it's just due to the nature of an FAA, we cannot require this of you, but that doesn't mean that, you know, we wouldn't appreciate it if you sent it to us, because if we do not have any financial data for you as a partner, I think it's difficult for us then to sort of discuss what your impact is to the OU and to a lot of the portfolio of Usaid for that country. So I would really like you to discuss this with your COR. Again, I know that this is sort of conflicting guidance, but just consider that while it is not contractually required of you to submit a template, it does advantage you if you do submit to us so that we have your data and we can basically demonstrate your impact and tell the story of what you do. So to answer that question in a sort of long-winded way, yes, to all contracts and coags and things like that, expenditure recording is 100% required. It is in all PEPFAR agreements, again, including a fixed amount award. But with a fixed amount award, it is technically not required, but we strongly, strongly recommend it so that we can advocate for you as our partner. And especially considering all of the work that we've been doing with local partners over the last few years. And there's a couple of OUs, a couple of countries that we have a lot of fixed amount awards. You know, Usaid really, if we didn't have any of these partners reporting, it would be very difficult for Usaid to really say what our impact is, even within a country. When we start to aggregate that. So if I know don't want to go too much into Sushant's time. So if I can maybe fly through these next couple of slides, they should be very quick. And then maybe I'll take another couple of questions and then hand it over to Sushant. But I wanted to just make sure that you are aware, and we'll send these slides out. ASAP will post these or send these out to you. But essentially, there's a lot of different resources that are available to you as an implementing partner to know what to do if you have questions. Datum.zendesk.com is essentially the hub for everything that you will want. On the guidance side of things, this is where you can find the template, the classification reference guide, and the things like what's new for COP22 fiscal year, COP21 fiscal year 22 reporting. What is the step-by-step checklist of what I need to do? Things like that can all be found in the guidance section of Datum Zendesk. I wanted to make a specific plug for the Financial Classification Reference Guide, because I'm not sure that everyone fully understands how amazing this document is. If you have a lot of questions on how does a certain activity be categorized, if it's service delivery or non-service delivery. And if you take a look at the screenshot here at the left, we have an extensive bank of examples that are included and not included for all of our program areas and subprogram areas, beneficiaries, cost categories, et cetera. We get the question a lot of, how do I categorize rent? You can download this document, just do a Control F, just search for rent in that document, and it'll tell you the exact cost category that you should allocate that to. We get a lot of questions on, how do I allocate referrals and linkage related activities? Does it go to testing or does it go to treatment? You can find that information here. So please download. You don't have to read the whole thing. I mean, a lot of it is operational guidance as well. But when it comes to, I have a certain set of lump funds that I want to allocate somewhere, but I'm not sure what category it goes to. This is the document that has all those definitions. The next one that's going to be super critical, especially to the prime partners, but also to the subrecipients that will also be completing an ER template, is in the Datum Training and Tutorials section of Datum Zendesk. And so this is, these are fantastic step-by-step instructions on common errors in the template, how to correct the errors, how do I create a username, how do I upload the template. Especially the file that is instructions for IP users, download that. Again, these are not posted yet for the current year of reporting, so give it like a week or so. But these are going to be your best resources for actually completing the template and submitting the template. And then the last thing that is a huge plug of mine too is the help desk ticket system. So every year I get questions forwarded to me on, I don't see my organization listed in Datum. I don't understand why I'm getting an error upon upload. There's all kinds of technical glitches that may happen. 9 times out of 10, if you don't know the answer on the technical side, I probably don't know the answer either. So if you go to Datum Zendesk and click on Submit a Request, this is essentially the help desk. A ticket will be created and someone will reach out to you. If it's been a few days and no one's responded to you, maybe you can follow up with the help desk and see if you can get another response. If you still are not getting a response for them, although in my experience, they've been pretty responsive, then you can reach out to someone at Usaid and we'll get you an answer. But it's the help desk. I mean, most anything that's related to a technical glitch in the system, I'm not a technical person. I have a very limited Datum account as well. There's not much that I can do to help you. So just go ahead and submit a ticket. And just keep in mind too that, if you're going to submit the day before the deadline, there's probably going to be a lot of other people in the queue ahead of you. So this is just another plug for submitting that template early, because the help desk will be slammed with responding to other data help desk requests. So just report early as you can and understand that as it gets closer to the deadline, the help desk might not get to you before the deadline. That's just kind of the risk. There'll be some additional resources that Usaid will distribute to you. Stay tuned for that in the next week or so, and that will come from your COR, your activity manager. I also wanted to make a plug for those local partners who are based in Africa only. Many of you may have had technical assistance consultants previously. You will have those technical assistance consultants again this year. Again, unfortunately, we can only have it for the local partners that are based in Africa. And you will have that support for expenditure reporting, as well as the HRH reporting that will take place from October to December. So we will reach out to you in the next coming weeks with the contact information of your consultant. And some of the things that these consultants can help you with is categorizing and allocating expenditures, understanding the framework that we just went over, reviewing your template for any accuracy, for any red flags or anything like that. And then keep in mind that the consultants do not have Datum accounts. So they cannot complete the template for you. That is not their job. You as the implementing partner are responsible for completing your template and collecting any subrecipient templates. But they can look at your template and they can say, oh, I see a red flag here, you need to clear that. Or they can go through the guidance document and say, while I as a consultant may not have a datum account, this is what looks like you might be able, some steps that you can take to be able to successfully submit. So more information coming on that for those local partners that are based in Africa. We have a lot of folks I saw on the call that aren't based in Africa, or you may be an international partner. And so just keep in mind that there will be technical assistance still available to you through your headquarters-based expenditure reporting backstop. So someone like me and someone from my team, every single OU has an ER assigned backstop. And you can reach out to any of us. Your Usaid contact will know who we are. They can also reach out to us as well. Or if you have any other questions, bookmark the oha.ea@usaid.gov, and we'll also make sure to answer any of your questions that you may have. And then the last thing I wanted to just kind of make a plug on is we often get questions from partners on what do you actually do with this data? And I just want to assure you that even though that we know that you're spending tremendous amounts of time completing this template and often just wonder, does it actually go anywhere? Do you actually do anything with it? And I can assure you, we absolutely do a lot with it. Again, we essentially process this data, a structured data set is completed, and then we load this into all of our agency dashboards where we have countless visualizations where we're looking at basically PEPFAR achievement at a mechanism level, at an agency level, at a country level, at a global level. We're looking at trends over time. And we really just want to better understand how we're doing. Are we investing in the right people and the right groups of people? Are we seeing improvements in some of our target achievement? One thing that when we look at our financial data next to our MER results, a lot of times what we see are partners who might have spent 100% of their testing budget, but then let's say they only achieve 60% of their targets. We want to understand, why did you only achieve at 60%, but you spent your full testing budget? And again, there's probably a lot of different good reasons for that. You might have been underfunded for testing. Things might have been more expensive, delays in implementation, challenges in implementation, all kinds of things. But we want to understand what's going on, which is kind of another reason why we say, don't just report your expenditures in the exact mirror image of your budget. Because if your target achievement is poor, and yet you're telling us, oh no, we spent the budget perfectly. That's not great. We want to better understand what's going on there. So that data quality and reporting is really important. So what I think I actually might do in the interest of time, because I know that Sushant has a great presentation from the partner perspective, I'm going to hand it over to him and pass that over to him now. And I think we have one more poll question before he gets started, maybe while he's pulling his presentation up. Thank you, Susan. And yeah, I will stop sharing now and hand it over to Sushant.
Perfect. And Erin, if you'd like, you could actually go into the Q&A and type answers to any of the questions that you see there, if that's something you'd like to do while Sushant is sharing his presentation. And just as a reminder for everyone, we'll go ahead and share that Q&A document after the webinar as well. So all the questions that you've added to the Q&A, thank you so much. And we will go ahead and provide answers to those following the webinar. All right, and I'm going to go ahead and close the poll and share results. Excellent. So it looks like people are getting more comfortable with the process. Over to you, Sushant.
Great, thanks everyone. Just to confirm, you can hear me okay? Maybe just
yes, absolutely.
Great. Thanks everyone. It's a pleasure to be here. Thank you for inviting me back. I did a version of this presentation last year, and so it's exciting to to be back and share kind of an implementing partner perspective. I've been involved from the partner perspective on expenditure reporting and its predecessor, even expenditure analysis, for several years now. So I have some experience with it, and hopefully can provide some insights, especially for the 4% of you who are still like feeling a bit overwhelmed about where to start, and then hopefully even for some of the others who aren't yet very confident. Hopefully I can provide some tips or tools on, or maybe just reassurance on how to feel better about what is, and can be quite an intense and overwhelming data collection exercise. So with that, let me go ahead and kind of get started. Let's see if some reason there we go. Okay, so first of all, I wanted to just basically go over the guiding principles we use at EPFAR in terms of approaching ER. The first one is a phrase I feel like applies pretty well to this exercise, which is don't let the perfect be the enemy of the good. I'm sure a lot of people on this call are or tend to lean towards some form of perfectionism. I know that in the finance and accounting realm in particular, people like to balance things down to the last penny, and every cent must be accounted for. And while of course that's very appropriate for some elements of finance and accounting, in fact, not just appropriate, maybe even required probably for some elements, I think that's not true. I think a lot of what Aaron said sort of hopefully kind of conveyed that as well. But the ER is not trying to get down to accounting for every single cent. I would almost argue if you try to do that, you may end up compromising the entire process. So really the goal should be obtaining thoughtful estimates that reasonably represent the reality of the project spending, and that's the realistic goal you should hold for yourself, rather than trying to rebuild systems from scratch, for example, or make major changes to systems. Minor changes certainly feasible and possibly important, but not major changes to capture this data at a high level of precision, because you might not even get there. So I think that's maybe one overarching guiding principle that I like to just share in terms of our approach. Dialogue and collaboration. So ER is very multidisciplinary. It's actually one of the things I like about the exercise, in that it necessarily involves a wide range of stakeholders, right? So I'm sure many of you are finance and accounting folks, but maybe there's others on here as well. And even if not, certainly one would hope that you're now interfacing with your other colleagues, because I think sometimes what happens is that expenditure reporting, people see the word expenditure and immediately assume this is a finance team exercise, when actually it's much more collaborative than that. Programs staff, M&E staff get involved, grants staff may get involved, perhaps even more so this year, given that there's an expectation, a requirement that subgrantees spending over $25,000 will also be completing templates. So you really shouldn't be completing them without close collaboration from all stakeholders, as well as clear dialogue with the donor throughout the ER process. I think that's also a really important piece to emphasize. So please don't feel like, even if now you've taken this webinar, that you are alone to kind of implement this this whole exercise. You absolutely need to be leaning on the insights and technical knowledge and other knowledge of your coworkers, as well as the donor, COR, etc. Learning. So as much as feasible from our perspective, I don't know, I think this was in my intro, but maybe just to remind people, I work for the Elizabeth Glaser Pediatric AIDS Foundation. Its acronym is EPFAR. It's committed to using the ER data to learn about its programs, including whether, as Aaron said, in terms of how USAID uses its data, we try to use the data similarly. Are we adequately investing in certain program areas? Are we over-resourced in some areas that are no longer a strategic priority? And use the ER data to have more informed dialogues with the donor. So for me, I think if you take the report from that angle, you might be able to get more insight, and get better data quality than if it's treated strictly as like, this is what the donor needs, let's just get the donor what they need. which to me would be a bit of a shame if there isn't at least some learning or some insight for you as the implementing partner, right? I mean, certainly we have to do what the donor asks, but in the best case scenario, there's something of intrinsic value there for us as well as implementing partners. So we try to take that approach and philosophy as well. Our methodology at a glance, and after this, I'll try and go through a little Excel template where it's a very rough mock-up of like kind of our approach as well, in case that's at all helpful. And I think we may be able to even share that afterwards if people are interested. But so we do directly assign some costs. So where feasible to directly assign expenses, we will do so. For example, if under a given mechanism, we know we purchase cervical cancer supplies. So then we will clearly assign those to a cervical cancer intervention under the health supplies cost category. I will say the minority of our expenses are directly assigned. I couldn't tell you right now for sure how much, but it's probably more like a third, a quarter to a third. So we do not necessarily try to go through every single transaction under every single award and make sure everything is exactly coded to a given ER intervention, for example. A lot of that we use what we think are perfectly reasonable allocations to get to good estimates for those. But for some that are pretty clear and easy to find within our accounting system, we certainly will take the time to do that. Salaries, for us as an implementing partner, this is a pretty big cost category. And not only is it a big cost category in and of itself, but for us, it's often a driver as a basis for allocation for other cost categories, such as, for example, domestic travel, which is a category for which we do use staff as a basis for allocation. You can try and go through that in the Excel template afterwards. So staff time for non-operations staff, and by operations is, I think everybody has their own terminology, but I think you guys know what I mean, like more support staff, finance and accounting staff, for example, and other kind of support admin staff, etc. Leaving those aside, taking really, and I say leaving them aside because typically those folks would be allocated to the program management intervention. Usually you have at least probably just one, but you might have two. I think I've seen in some cases where your award is perhaps closing out. I think there's like a second program management award for closeout, for example. Anyway, so those ops staff typically will be going into those program management buckets. But for all the non-ops staff, you need to find a way to assign them to specific interventions based on a level of effort estimation. We don't do that through timesheets. We've explored that, and we found that we are getting people to fill out their timesheets on time, accurately by project is already really crucial and already a bit stressful sometimes. And so we don't want to now jeopardize that process by also asking people, hey, by the way, within the USAID grant in Uganda, make sure you code all of your hours by specific ER interventions. To us, that felt like a lot of additional time that would compromise how timely the timesheets would be submitted, and not clear that you would get better data quality, not clear at all, because obviously you would have to take all those staff through what are these different interventions, what do they actually mean? Some of them may come out, let's say you have 25 technical officers, they may interpret what those interventions are quite differently. And so now you have non-standardized approaches. So this is an example of something where you're trying to maybe get things exact. And by trying to get things exact, you might make things worse. Not saying that some people might be doing that and then go for it. Absolutely. If it's working for you, fantastic. To us, it felt quite painful and for not much value add. And so if anything, maybe value loss. So we don't do that. So what we do instead is the senior technical staff for a given project will kind of get together. They are typically the people who would supervise or be the supervisors of the people who supervise most technical or non-operation staff implementing the project. And they will have kind of a thoughtful discussion about, look, based on the interventions in our given project, can we look at the cadres that support our project and think about, where, like, based on their job functions, like what are the interventions that they support? And again, in the template, I can try and go through that. The subs thing, this is perhaps a little outdated, but in the past, subrecipient costs were assigned for us to specific interventions based on the estimate of which interventions relate to their technical scope. If you have subgrantee A and they basically just do OVC work and it's all very much kind of service delivery, then we would basically take the entire amount of the sub expenses in that given year and assign it to that specific intervention. But if they have multiple interventions, often it's the senior technical team working with the grants team with some consultation with subs, but in the past, not necessarily very extensive consultation, because especially in countries where we have like 45 sub-grantees, right? So that we would basically have a discussion around what makes sense in terms of a distribution of their spending based on the interventions. This year, the approach is going to be even more collaborative. In the past, as I said, we would consult subs, but perhaps not always very closely with every single sub. But now there will have to be some level of that collaboration. We would like to have started that process already. Right now, all we've done really is given subs a heads up that this is coming. In an ideal world, we would have already started this process. But we recognize this the first year. Let's kind of learn this year how it goes. And then starting next year, I think we would get out ahead of this a lot earlier in terms of preparing our subs. Typically, again, what we would still have is some understanding ourselves as ECPAF of this is kind of what we think is how we would break out the spending for a given subrecipient based on the technical scope. And then we would go to the sub and see if they agree, and perhaps they point out some differences, et cetera. Then we readjust, and then we kind of move forward accordingly. In terms of the process for upload, etc. I guess that's all new, so I can't really offer guidance on what's best, from that perspective. But I will say, if there's one thing, as is true with any new thing, if there's one thing in this year's, when Aaron asked the question about feeling confident, this part makes me slightly nervous, because obviously, especially in mechanisms where we have many sub-recipients, what if there's like little upload errors, etc. And now you're not just uploading one, but often uploading 10 or 15 or 20 or more. So that's the part that gives me a little nervous, just so you know. It's okay to feel nervous. Other cross-cutting costs that benefit more than one intervention. So I would say the majority of our costs are allocated. The majority of our costs are cross-cutting. They often don't just hit one intervention very neatly. I would imagine that's true for several of the other partners, organizations here. So we do allocate based on a number of possible strategies. We use LOE, level of effort. We often allocate travel costs, for example, by the level of effort of program staff. Since for large projects, for us, it isn't really feasible to code each site visit expense with a specific intervention. And labor is conventionally seen as an appropriate proxy for travel and various different kinds of cost allocation methodologies that you might have been exposed to in the past. Since it is literally the people who are traveling, the way they spend their time is a useful basis for doing some of those allocations. Now, if you have databases that capture very well all the site supervision visits and those line up pretty clearly with a given intervention, absolutely you should use those. In our cases, there are a couple of countries where there is some of that, and we try and leverage that data. But in general, we would use level of effort as the primary basis for allocation for domestic travel. Technical allocation. So this is, again, where there are types of expenses. For example, let's say we are doing a training on HIV testing, but these trainings cover both facility-based and community-based testing, right? And those are different interventions. So now, finance team isn't going to decide, well, let's just call it 20% facility and 80% community. that kind of those kinds of allocations would be done by senior programmatic staff, who will determine the kind of most appropriate distribution of certain costs by an intervention. Patient volume is another one. We may allocate certain costs by volume of patients related to a given intervention. That's one we've used as well. One that's not here, but I think it's okay to include sometimes as a reference point, and I hope I don't get in trouble with Aaron on this, is you can use the budget as a reference point. I agree that you definitely shouldn't just take the budget blindly and then just like, say like, these were your costs, because we all know that the reality is that spending can happen quite differently than how things are budgeted. But it's okay, I think sometimes, let's say you have for us, for example, trainings and meetings are a good example where we have some disaggregation in our financial system, but it's not always very neat and easy. So sometimes going back to the budget as well and seeing like, well, what were the various trainings and meetings that we budgeted, and then triangulating that data for us can be sometimes somewhat helpful. So maybe let me just quickly go now to like kind of our process as it is. So typically what we do is we have an internal allocation template, a very kind of crude version of which I will share with you guys, and maybe we can walk through together briefly. And we kind of build and update that every year for, let's say, some a new cost category. For example, recently, I think last year or the year before, they disaggregated staff by clinical, ancillary, and then also other, like those kind of, similarly with contractual. So we like update our internal allocations to mirror that. And then we develop the allocations for personnel, subs, and other expenses that are to be allocated. And then we pull in the expenditures from our financial system and then compile a first draft using our internal template and what those total expenses were. Then we do basically a reality check. We do some analysis. We do a reality check as well relative to the COP work plan budget, the PET, and then adjust if we feel like, I don't know, there's something in the data isn't actually accurately conveying the reality of the implementation. And again, here, to go back to Aaron's point, I would agree that we definitely, what we don't do is kind of blindly use the COP work plan budget, but what we had previously submitted for how we would spend this money, which was based on what the COP allocations that were given to us. But we will use it as a reference point, because if there are some pretty big discrepancies, even if that's fine, we would want to be able to maybe even put some notes into the submission as we submit it into Datum, because there's areas where you can do that, or anticipate that that's something that could be flagged, and so have some answers ready. And in some cases, it's possible after doing these allocations and seeing that there is a discrepancy, that we go back and revisit and actually be like, actually, no, we did mischaracterize these particular types of expenses. So let's revisit that. We then do a review, obviously, of the complete ER draft. We revise based on that feedback, and then we upload and submit to step process the ER file into Datum. Again, just worth mentioning that the updating of an internal tool, as well as developing allocations, this can start obviously before like all expenditures are captured, and I think it's good to do that. And then the bit about conducting the analysis, I think this should involve senior leadership in your within the award. So maybe the project manager, any senior kind of technical folks who are well versed with what are the strategic priorities for this given project. What is the story that our data is telling us? Is that story accurate based on what has actually happened over the course of the past fiscal year? So I think that's. I think I already mentioned this. A multidisciplinary approach is essential. Obviously there's different groups and ER kind of that play into all of this, and expenditure reporting really kind of fits into the heart of all of this. And in terms of some of the different roles for programs, for example, technical allocations for things like staff and subs and other costs, help to define cross-cutting allocations. E.g., let's say we did some renovations for waiting areas. What are the interventions that benefited? Finance and ops and M&E is not going to easily be able to tell you that. Triangulating with the MER data, for example, if we reported MER data on VMMC and HTS index, but we don't have any costs reported for those program areas, that's going to be flagged and look weird. And maybe there's a good explanation, but that's where we do involve our M&E, SINE folks as well. And then obviously finance ops is going to be heavily involved, ensuring the total dollars align with spending during the reporting period. And then where, for example, also we're doing coding and tagging of individual transactions to interventions. As I said, we do that for the minority of our expenses. We don't do that for the vast majority. But again, if we are doing that, then obviously the finance and accounting team is going to be involved in that. And then obviously being a focal person for the overall exercise, I think. Maybe just some real quick lessons learned and recommendations. I think I already talked about this. Having senior management develop allocations for staff elicits better data quality than asking individuals to disaggregate timesheets by intervention. That's our experience. Might be different for some others. Subgrantees, grant and tech. This again might change a little bit this year. Grants and technical teams can work together to determine which interventions are relevant for a sub-award based on its technical scope. Now that ER has moved to sub-level reporting, Prime should develop some kind of internal guidance and an internal communication or training for sub-partners to ensure the subs have some understanding, have the same understanding of the ER guidance. And so if you're thinking, well, this year it might be too late to do a formal training, I think that's okay. I honestly, I don't know that we will be able to do a full formal training for all of our sub-recipients prior to the start of the process, which starts obviously in less than a month. But some kind of communication, some kind of even high-level orientation, just so they are well-versed with at least what it all means and are not intimidated by the template. I also see us possibly with some partners maybe collaborative, getting in the same room or the same Zoom room and kind of looking at the template together and kind of doing walkthroughs. Communicating with the donor and the mission regularly, so critical to reach out kind of proactively to missions about the ER prior to submission, especially if you see things that they might flag. But I think in general, including advice on how to handle inevitable deviations between the spending by intervention and then what was the COP allocation FAST tool or PET or work plan budget, lots of terms for that, but the intervention budget that was kind of given to you. And also reach out to the USAID HQ liaisons for ER reporting who can play a key role interfacing between missions and partners. Sometimes a mission might have a slightly different understanding. And in that case, I think it's okay to reach out to, let's say, a global resource person that's been identified to you or your consultant that might be available to you. Other quick lessons learned and recommendations: radical changes in coding and capturing data is not always necessary or advisable. Again, that's our experience. Focus more on how you can adapt existing systems procedures to capture better data and less on rebuilding systems from scratch or hiring additional HR to focus exclusively on ER. So for example, some changes we did make is rather than trying to find some new accounting software or change how we capture financial data, we did start using a field in QuickBooks to start tagging expenditures that could be directly assigned. For example, program supplies, trainings. Sometimes these are often just for one intervention. And so we would actually tag those with a given field. We also did other things like modified our budget template to start better thinking about what staff are clinical versus ancillary versus other. We did the same thing with contracted as well. Again, just to mirror the cost category. Sometimes that can be somewhat helpful even upfront to get a sense for all right, these are the staff that are being defined as other, these are the staff being defined as clinical and ancillary. And obviously using the classifications guidance, the overall guidance on making sure we're defining those people as per the guidance. I would say other things, state your assumptions. I think allocations and assumptions are fine, but obviously clearly state and document any assumptions in any internal template you're using, because this will allow for help in ensuring consistency in reporting. SD versus NSD, service delivery versus non-service delivery. I saw at least one or two, maybe a few more in the chat questions on this. Honestly, it's one of my biggest frustrations with this whole process. So I don't really have an answer for you, but I would say just do your best and focus on getting the program area right. Aaron also mentioned, for example, in some cases, it's perfectly appropriate to lump. We will do that from time to time, often. For SD versus NSD distinctions, typically our experience, and the experience of at least a few others who are in the chat, is that not enough funding is provided to NSD interventions. Not sure why, it's just what it is. Non-service delivery interventions just don't typically have enough money spent on them. I see some applause, some people agree with me. I think that needs to be changed, but that's way beyond my pay grade. So that also means that if you have things like training, and I believe someone else mentioned something like construction, I think that's a fair one, we don't do a lot of that, that now Datum is going to flag that as a warning if you have trainings expenses, but they're showing under a service delivery and not a non-service delivery. My experience in that situation is to just ignore the warning because that's more accurate. Otherwise, if the mission comes back and then submit it, and then the mission might come back and be like, no, this isn't cool, you can't have trainings under SD, then ideally, if you have time, ask the mission, well, where do you want us to then put it? Or if there's a corresponding, let's say it's some kind of an HTS training that's, by training, yeah, technically it is NSD. If there's a corresponding SD intervention, kind of lump it in with that, going back to using kind of Aaron's language. So I would do one of either. If you feel you can either lump everything under the corresponding SD intervention, go for it. But I sometimes make a point of actually putting it elsewhere and having that dialogue, even during or before with the mission, and say that, look, I mean, you've seen our actual budgets, our work plans, we do supervision, we do lots of trainings, that those things are non-service delivery, and yet in some of our awards, sometimes we have no non-service delivery except program management, right? And so then it's just like, well, I don't know how to fill this out. So I think that's something that is kind of a larger issue, but that's how I typically have navigated that, is classifying it under the NSD spending, but still having that conversation, because I think it's important for the mission to know that. Lastly, I would say start early. Most work related to ER reporting can be completed well before all expenditure data is captured. That is true. So even though we're waiting for the template, et cetera, I think, Aaron's already given us that kind of helpful overview of kind of what the new things are. And so that's good enough, I think, for us to start doing that outreach and communications to our subs while we wait for the template to come through. Usually, I would say we would typically begin revisiting assumptions, updating allocations, and compiling the initial spending data even as early as August, recognizing that all the spending data isn't even in, because that will only come through for us. The end of September data usually only comes through by, let's say, mid-October, but we can certainly start the whole process earlier. So I'm listing my email address because just in case people want to email me directly, I'm quite happy to try and field any questions you might have. And yeah, just wanted to say thank you. Maybe I'll stop here for questions, but then I can also, if anybody is interested, I can walk through the Excel template, a very rough Excel template that we also have. Thank you.
Excellent, so, yeah. Thank you. Aaron, would you like Sushant to go through the template, or would you like to do some Q&A? We have about 20 minutes.
I might ask Sushant, since you and your organization have put together this really great template, maybe if we can ask you to walk through that first, and then we can do questions. And I guess the only thing that I do want to, before Sushant digs into this, I just want to say everything that he said, I wholeheartedly agree with. I think his perspective and his experience is really fantastic. And all of the challenges that he notes are correct. And I've been nodding my head at the same time. This is an imperfect process, but I think they've done a great job of sort of making it work for their organization, particularly given the challenge of working across so many different countries with so many different mechanisms. It's a lot to coordinate. So just thanks again to that. And then as Sushant is going through this template, I want to just make the very, very quick distinction, if everyone just kind of quickly hears me for 1 second. This is not the ER template. This is not something that you must complete. This is not a PEPFAR template. This is a useful resource that was created by Sushant and his team to help them translate some of their the data in their accounting system to what ultimately will need to get into the PEPFAR expenditure reporting template. So what he is going through is something that some of you may think, gosh, we don't know where to start. This might be really helpful. let's give this a try. And some of you may think, you know what, we think we're going to go a different direction. So I just want to make that clear distinction that I think this template is a fantastic resource for those partners that are doing this for the first time and don't really know kind of how to translate that accounting system data to the official PEPFAR template. But this is not a required, like what Sushant is showing you is just a resource, if it's helpful to you, that he and his team created. And it not something that you have to complete in advance of the PEPFAR ER template if you do not want to, just only if you find this helpful. And I found it helpful. So I think it's great that he generously has donated this template for all of you if you do find it helpful. So that I will stop talking and hand it back over to you, Sushant.
Thank you. And as you'll see here, it's not like some amazing template. It's pretty simple. I think that maybe that's the good thing about it, is that I think it is quite simple. But I think maybe just to clarify, so what we will do is we will basically have our internal template of some sort, and then we'll run our numbers through that internal template and then come out with an output that is basically what we will copy paste into the official template and then do the upload. Rather than working kind of directly in it, right? In the actual official template, rightly, a lot of the cells are protected, etc. And so anyway, so I'm sure that's several of you do that kind of similar thing where you have kind of a separate file where you're kind of working in. And so that's us as well. We have several allocations and other expenses maybe that are directly assigned, and then they flow into this tab. I know it won't be easy for many of you to see this. And thank you, Aaron, for clarifying. This is absolutely just our organization's thing. And so just if it's at all helpful. But so you may not be able to see it well, but I think after the fact, I believe last year we were able to just share this thing in case people do use it. So hopefully then you'll get more insight into it. But as you'll see here, this is a mirror really of the template as it currently stands. We'll try and have it so that literally copy paste is very easy. I think this year, for example, the subs maybe even goes down below the indirects. There's a couple of things where we might even still have to change it to get it aligned. But this is ultimately everything here has formulas associated with it, right? So nothing is entered directly into this tab. So I'll start first with the last tab just to give you, this is basically, it literally is just the table of, I'm sure whatever accounting system you use, ultimately there are ways for you to aggregate your spending by certain traditional, so not necessarily PEPFAR ER, but the more traditional USG cost categories, right? Personnel, fringe, travel, equipment, supplies, contractual subs, and artist trainings and meetings. And so I'm assuming like many of you will have the ability to aggregate at this level fairly easily, since some of your formal financial reports, et cetera, might require you to do that anyway, right? So this is kind of like that starting point. So then let's go, starting from here real quick, what we'll have is staff. Like this is the big one for us, certainly. And again, I'm sorry, it's not very well set up to see this on Zoom per se, but again, hopefully afterwards you'll be able to see it. But you'll see here, I have all of our interventions. This is a mock made up award, right? It has however many 13 interventions ranging from above site research, prep, all the way to obviously the program management intervention. And so what I'll have here is staff, and I will categorize staff. We will categorize staff by whether they're clinical, ancillary, or other. We'll try and like roll these up. Also, sometimes these files end up getting shared with quite a few people. So even from the perspective of like, I don't know, we don't want to like compromise salary confidentiality, etc. So I mean, that doesn't, ultimately it's a small group of people that collaborate. And in some cases, there's literally just one position. Obviously, if you have a country director, etc. So sometimes we'll even hide things, but this is a made up example just to show you how we do the process. So let's say we have 10 linkage nurses, right, that are dedicated to the project. And let's say their annual salary is 20,000. So we'll have kind of whatever their total is. And then these linkage nurses work across we will literally work with the senior technical people, and they will tell us, look, what is appropriate for a linkage nurse, right? What is their kind of job function? And perhaps it's broad-based. You know, maybe they do some work on testing, because obviously they'll do the actual linking then from those who test positive, perhaps to do a referral or to get them to get enrolled onto treatment, etc. Then we have VMMC surgeons. This one's pretty easy. They're not always this easy. Most of them are not 100% to one category. But here, let's say we have a VMMC intervention, this one, VMMC SD. And so we'll be able to allocate that person 100% there, those people. And then we have clinical officers, which even just from the title, again, you can tell that probably is not just one intervention, but a few. We would allocate that out based on the senior technical staff's input. Then we have ancillary staff, right? And again, all of these classifications are based on the guidance, right? Lay counselors are typically not necessarily people with clinical training and aren't necessarily providing clinical services, but they're providing other really valuable services. And so, you know, these are some of the kind of lay counts, the ancillary cadres we would typically have. You know, VMMC mobilizers are people who do like demand generation and stuff in the community, et cetera. And so, you know, these are people we would also allocate based on their primary responsibilities. And again, here it's primary, right? If like the lay counselor occasionally gets looped into prep, but it's like just a notional amount of their time, it's debatable. Often we wouldn't really include that per se. So sort of that same approach to lumping would apply in terms of assigning LOEs to staff. Then we have other, and then under other, let's say you have your country director, your technical director, et cetera. Some of these people, the most senior, typically will have some LOE under program management. So typically for us, we will have some of our most senior staff also, even though they're not operations staff, will obviously have a program management level of effort. And then, you know, and some, it might be 100%, some it might be quite a bit less. And then again, to restate, in addition to obviously the operation support staff that typically would go there. Also, data clerks is kind of a good example of one that, you know, we have a lot of technical advisors. Typically, some of these have very specific clinical domains, and so you can assign them to that specific domain. Research coordinators and research assistants. So these ones typically will go to the above site research intervention, for example. Sometimes also a little confusing, by the way, because sometimes research assistants are always based at sites. But, you know, we want to capture that research element. So we'll say like above site, et cetera. I think the point being that the research activity doesn't just benefit those sites, right? It typically should benefit all sites. So anyway, that's the staff that we do. And then we do a kind of, this looks confusing, but if you follow the logic, we'll basically do some kind of an allocation that we'll have an overall allocation, and then we'll do a weighted average based on the expenditures by clinical, by ancillary. So we'll have a way to then spread them out in total, because obviously you have more than one clinical staff, right? You have, well, however many, 3 here. And so we would take the kind of total spending based on the LOEs proposed and calculate a weighted average. And so then in this row for personnel healthcare clinical, this is capturing that weighted average calculation, right? So it's across all of those clinical cadres. Similarly for ancillary, and then similarly for other. As you notice here, I put other non-ops and then ops, because ops typically would be routed completely to program management. So you just link it in directly into the ops. This is hard to explain on Zoom, but again, since we will be sharing the template, I would advise, if you are interested, I would advise you to just kind of follow those formulas and see if you can follow the logic. And if not, email me and we can try and kind of walk through it together. Travel. So typically for travel, what we'll do is we'll do international travel. Almost always is for us, it's usually program management. It's sometimes from our home office. We're an international partner, right? So going to the country, and they're not necessarily, they might go and visit sites, but they're typically providing kind of more management level support and oversight. Sometimes we have research staff, like higher level research staff. So sometimes that's also an above site category. Like for example, here, let's say we had $7,000 in international travel. In this case, we decided to allocate these 70% and 30%. These can sometimes also be for things like travel to IAS for our local staff, right? To go somewhere. That might be true for some of you who have kind of local, who are local partners, which is all of you actually. And so, that could be another area. But typically we wouldn't have international travel so much into the site level interventions because that would look a bit odd, I think. And then domestic travel, we almost always mostly use level of effort as the driver for this, but there are a couple of countries where we have more granular information about site supervision visits, about other things where we will kind of include that information as well. But the primary basis for allocation here is these allocations kind of blended together, right? So that's travel. And then this is equipment. Obviously there's two categories, health and non-health. I'm assuming most people aren't buying like tons and tons and tons of equipment. So this one's pretty easy. If it's health equipment, usually it's, quite specific to one or a couple of interventions, but it might be more wide ranging. And then non-health equipment, for example, project vehicles, we might allocate these we allocate these in part based on, completely on the guidance, which allows us the flexibility to not just allocate them to program management, right? If their use is primarily for site supervision, for example, site visits, we'll come up with a general kind of allocation based on our kind of other expenses, again, possibly based on staff as well and how much time they're spending doing supervisions, etc. So that's that. Sorry, I'm racing through these, but I want to make sure I get through enough time for Q&A. We have health and supply. So this is an example of, let me enlarge this a little so you can see where we might allocate based on actual expenses, right? So we purchased 160 packs of glucose sticks. We had in our QuickBooks, for example, a memo, a customer field that allowed us to know which intervention this routed to. Similarly for some of these other things. Again, you don't necessarily need to do this if you have thousands of transactions, but for us, we felt like for some cost categories that are fairly clear and map pretty easily to a given intervention or a couple of interventions, we do take the time to do that. And then there's also other supplies here, printing. We do a lot of kind of printings of prep, for example, job aids, that'll go 100% to prep, for example. Right, let me just keep running through here. This is the subs one. As I said, we are allocating, right? Based on, we know their technical scope. I mean, our technical teams are the ones who negotiated that technical scope with them. So perfectly capable of having a good handle on kind of how they're spending their time, but we do consult them. And this year we'll be consulting them even more. And obviously they would probably take the lead in populating that template. And then based on their actual expenditures, we come out with what we report. Contractual allocations, there's contractual clinical, contractual ancillary, like stipends to mentor mothers, contracted interventions, which is a bit of a catch-all one. We have actually even used this for some small grants in the past, but often they're things like a sample transport contract to a third party, for example. Those are some other things that we use for this category. And then other contractual, as you guys all know, is as many of you may know, is other operational office costs, and obviously for us, international organizations. Well, no, let me stop there. Yeah, it's kind of those kinds of operational office costs are the kinds of things that we would have there. Trainings, again, as I said, this is another area where sometimes we will have detailed transaction level information available, but sometimes not. And in that case, you can even reference other things like, well, what were the various trainings we undertook, like what's in the work plan, and then I go and find those data and know how to allocate them. Use the budget as well as a reference point, not as a blind basis for allocation. So those are some things we do. We have just the lists in here so that like everybody has, the drop downs have the reference point for the most current list of interventions in the guidance. And as I said, this is where we started from. So let me stop there. That might have actually confused people more, but if you get the template and start moving around in it, I hope that it'll confuse you less. Thanks.
Excellent, thank you so much. So again, we will include that template along with other resources that Erin would like to share with you. We'll also be answering some more of those questions that you have in the Q&A. We're not going to get a chance to do too many more today, but we will be sure to get answers to you and include it in a document, so you'll be able to look through those as well. So we will get the recording online for tomorrow morning, and a number of those other resources will be available there as well. I just wanted to set a quick reminder that we have a Human Resources for Health webinar coming up on September 8th. So that's Thursday this week. And you can go ahead and register online. I've included the link in the chat just now. So just scroll up a little bit, you'll see it right there. All right, and Erin, would you like to answer a few more questions? I'm going to actually just launch a quick poll while we're doing that, just as a quick satisfaction survey for our webinar today. But Erin, did you want us to cover a few more questions? I know we've had quite a number, and we really appreciate everybody being so engaged and throwing these great questions into the Q&A box.
Sure. Let me just, I just want to thank Sushant again for his time. You know, I think hearing from Usaid on what is the reporting requirement is helpful, but I think that as someone that does not complete the template and as somebody that doesn't have that perspective, it's hard for me to fully understand, you know, all of the questions that may come. I've been doing this a few years, but I think having Sushant represent the partner perspective, particularly, you know, knowing he's done this for many years, I just wanted to appreciate, you know, his time and just say that as the slides are disseminated as well as the video, please be sure to go back and you know, listen to what he said a couple of times and go through the template, because I do think his perspective on lessons learned is valuable. So if I was a new partner doing this for the first time, it's going to be slow going, it's going to be complicated, it's going to be confusing, but you know, kind of taking some of his feedback into consideration is really valuable. So please go back and look and listen. I also just want to make a plug for, again, those local partners that are based in Africa. If you're still feeling very nervous and overwhelmed, just remember that we are working through the ASAP award to have technical assistance consultants assigned to all of the countries in Africa with local partners. So not only will you have your AOR or your COR, you will have usually an expenditure reporting POC in that country where you're working. You will have a technical assistance consultant, as well as an assigned backstop from Usaid headquarters. So there is a significant amount of resources, just people out there to help you, as well as all of the materials that I mentioned during my presentation. I just wanted to, and so more information on the consultants is coming. We're still sorting that out. As soon as we can link you to your consultants, your Usaid POCs in country will make those introductions for you. So that is coming as soon as we possibly can get it going. And then I just wanted to also make mention that the materials are still not yet posted. I think most of the materials are not yet posted to Datum Zendesk. There's a lot going on in the interagency this week and next week. And so my understanding is that it's working through all the channels of approvals to get those tools and resources posted to Datum Zendesk. So I would have loved to have been able to say everything is live, go there now, and everything is current. But keep in mind, if you want to look at last year's materials, I think everything is still posted from last year, but don't download the template. A lot of the step-by-step instructions will change, especially with the subrecipient change this year. So I'd say check back in a week or two, and you should make sure that everything says COP 21 fiscal year 22, because again, you just don't want to be in that position where you go and do all of this work and your subs might do all this work and then you're working on last year's template, because it won't work. Final reminder that you know, the deadlines are hard deadlines. And so please just ensure that as you're going through the templates that, we can't accept anything through email. That's just not the way the system works, because this all is data that you're giving us. So sending me an email does nothing, because we need a system to process this data. So yeah, just reach out early, reach out often. There's a lot of things you can do now. Figure out what your UEI is. All primes and subs will need to enter a UEI on the template. Get your datum accounts sorted. Organizations can have 5 datum accounts if you want. It's totally up to you. You can have 10, you can have 1, it's up to you. Get your datum accounts sorted. Just kind of while we're waiting for kind of other materials to be posted, there's still a lot that you can do. Come up with a plan. If you're a prime partner, come up with a plan on how you're going to coordinate. Identify those subs that are less than 25 that will go on your template. Identify those subs that are greater than 25 where you'll need a template. Give them a timeline of when you as the prime will need to review their submissions before you submit it. So there's a lot, I think, that can still be done. So we're 1 minute over. I like to respect everyone's time, but I just wanted to thank ASAP for hosting this webinar, for Sushant for joining, and then of course, all of you for taking the time at this time of year to learn more. And yeah, don't hesitate to reach out with any questions. You're not alone in this. Thanks.
Excellent, thank you. And I'd just like to add, thank you so much, Erin, for all of your hard work on pulling this all together and your commitment to the local partners in the process. Thank you again, Sushant. It's so great to have local partner insight on these webinars. It's, personally my favorite part of these webinars, so thank you so much. And thank you so much to Usaid and PEPFAR for allowing us to put on these webinars each week. Again, we have the September 8 HRH webinar coming up, and I've included a link in the chat. So please be sure to sign up for that. And again, for the ER webinar, we're going to share the recording. So if you do have subrecipients that you want to provide some guidance to, you'll be able to share that as well. Thank you so much to everyone, and have a wonderful rest of your week. Bye-bye.
Thank you.